Good morning, everyone, and welcome to the Department of Health and Human Services. I'm Dr. Stephanie Herodopoulos, and I'm Chief of Staff of the Office of the Surgeon General. And I'm so glad you all could join us today for this amazing announcement on rare diseases. We are joined by a tremendous group here of people. We have obviously Secretary Kennedy, our head of HHS, as well as our administrator, Tom Engles, head of HRSA. We also have Representative Gus Bilirakis, Senator Britt, Senator Ron Johnson, and Senator Wicker. Thank you all for coming and being with us today. Your presence speaks volumes to the rare disease community and also to all the families. Thank you for the journeys that took you here. I appreciate how long and how far you came to join us with this announcement, and especially to our panelists. But every single one that's in the room today, your presence, your invitation was done on purpose because of your advocacy and what you've done in this space. So even though you might not get a chance to speak at the table, your voices are heard through others, and your presence here is acknowledged by our leadership. So with that, I'd like to introduce Secretary Robert Kennedy.
Thank you, Stephanie, and welcome to HHS, everybody. Like Dr. Herodopoulos, I too want to thank many individuals for being with us on this historic day. Among them are the patients and families of children who are suffering from Duchenne muscular dystrophy and metachromatic leukodystrophy. I also want to thank the members of Congress who have been instrumental in making this day happen. Many of them have talked to me directly. I won't say harangued, but have advocated for this community with great passion at this agency, and it is their urgings that we acted on this so quickly. Ron Johnson, particularly, I want to thank, who called me in the early September and said, we want to get this done. And I told him we would do it. So today is the fulfillment of that promise. We have Senator Katie Britt from Alabama, Senator Ron Johnson from Wisconsin, Senator Roger Wicker from Mississippi, and Congressman Gus Bilirakis from Georgia, and HHS Administrator for Health Resources and Service Administration, HRSA, Tom Engles. I'm proud to announce today that I'm approving the addition of Duchenne muscular dystrophy and metachromatic leukodystrophy to the recommended uniform screening panel. Thank you. And the stakes could not be higher. Early detection of DMD and MLD allows children to receive FDA-approved therapies at the most effective time, helping to slow the disease progression and preserve their quality of life. We now have developed cell and gene therapies that can actually cure these diseases. And if we detect the children very early on who suffer from them, we can save them from a shortened life of misery. And we can also, we anticipate the private insurance is also going to cover this because it creates enormous savings for them. Most children with DMD or MLD are diagnosed at 4 to 5 years of age when significant muscle loss or functional decline have already occurred. This is too late. Adding these conditions to the recommended uniform screening panel will encourage newborn screenings and help clinicians diagnose children earlier when FDA-approved treatments are far more effective. In April of 2024, the U.S. Food and Drug Administration approved a new gene therapy which can stop or slow the progression of MLD, but only if administered prior to the onset of symptoms. Without detection and treatment before symptoms arise, MLD is uniformly fatal. Several treatments for DMD are approved, And while no cure exists, new research published in August suggests early identification of DMD in a child improves the outcomes vastly. That's because clinicians have more time to come up with targeted, personalized treatment plans for a DMD. Without doubt, these early screenings will prevent severe disability or death in hundreds of children annually. Early detection will also give families a better chance to avoid the long delays, repeated specialist visits, and financial and emotional strain that often define years-long diagnostic search for rare diseases. These diagnostic odysseys can be emotionally and financially devastating for families who are in search of answers. As my uncle, President John F. Kennedy, once said, although children may be the victims of fate, they will not be the victims of our neglect. 1 in 40,000 newborns are born with MLD, and DMD affects 1 in every 5,000 newborn males. These so-called rare diseases are not actually that rare. The Navajo Nation is particularly affected disproportionately. Now, incident among the Navajos is 1 in every 2,500. And I have spoken repeatedly to Boone Negrin, who's the president of the Navajo Nation, about this, and he is very excited that we will be able to bring these remedies, these early diagnostics to his people. America's children deserve better, especially because the tools to improve their health outcomes already exist. Newborn screening isn't just a medical advancement, but a moral imperative. After we add these conditions to our recommended uniform screening panel, our work is not over. State adoption of our recommendations comes next. States will need, and Tom Engles is going to talk about where we are with the states, but states will need to add these screenings to their state universal newborn screening programs. With current levels of screening, most MLD and DMD diagnoses are too late. And this is a major reason why approximately 30% of the children with rare diseases do not make it to age 5. So states should choose to adopt our RUSP recommendations, and I commend the 14 states that have already introduced legislation mandating alignment with the RUSP. Their actions will give our youngest citizens the fighting chance that every child deserves. For reference, the 14 states are Alabama, and Senator Britt is in attendance, and she's another one of the people who rang my phone off the hook to make sure that we can make this available to the people of Alabama, Arizona, California, Florida, and I want to thank you for your help and your urging, Congressman Bill Rickus, Iowa, Maryland, Mississippi, thank you, Senator Wicker, North Carolina, Ohio, Pennsylvania, Tennessee, Texas, and Virginia. Timely care is compassionate care, and our children deserve nothing less. I'm proud of our team here at HHS for helping make this day a reality. I'm especially thankful to HHS's administrator for the Health Resources and Service Administration, Tom Engles, for helping to provide the leadership, technical assistance, and supporting evidence to make today's announcement possible. Thank you. And thank all of you. Thank you. Thank you.
With that, thank you so much, Secretary Kennedy. This is such a momentous day in history that for generations to come, this day will change the trajectory of lives for children, saving lives. And I can't think of anything better with a purpose-driven life than doing what we're doing today at HHS. With that, I'd like to introduce our administrator, Tom Engles of HRSA. I can't tell you how long and hard, how many hours his staff, his wonderful staff, small but mighty, worked on making this a reality today. Your staff is truly incredible. Thank you, Tom Engles, and the floor is yours.
Thank you, Doctor. And I really want to thank Secretary Kennedy. Once again, he has shown true leadership in helping thousands of families across this country. Earlier this year, I had a chance to participate in an event with Secretary Kennedy where we talked about organ transplantation and changes that he was making there. This is a secretary that knows how to lead. This is a secretary that takes the bull by the horns and actually gets the job done when families really need it. Thank you, Mr. Secretary, for your leadership. The newborn screening panel that we're talking about today, the recommended uniform screening panel, currently in the United States has existed for about 60 years. Over 4 million children are born each year, and not all of them have this opportunity to be tested. Thanks to Secretary Kennedy's leadership, these 2 diseases will now be added to that list that they can be screened for. Not all these children we can determine simply looking at them to see if they're healthy or not. Screening has to be done to help these families. Today, we have about 60 current conditions that are on that list. We're adding to that list today. Without newborn screening, families can spend a lot of time wondering what is going on with their child, how they can help their child, and their practitioners could be asking the same questions. What more do they need to be doing? Today, we're going to know from the very beginning what might be happening with that child and give the families hope and opportunities that currently exist, but that they did not know about it soon enough. As the Secretary mentioned, there are 39 states that HRSA currently funds that helps them with their screening programs. We are going to work with those states to help. And as the Secretary mentioned, 14 of them immediately going to be adding to this. Senator Johnson and I were talking prior to this, and it's great to have a fellow Wisconsinite helping lead the charge on this. But we are working to make sure that families get this added on. We want them to work with their state legislatures, and we want them to work with their state Department of Health Services leadership. I'm a former deputy secretary of the Wisconsin Department of Health. I know the difficult process it takes to add screens to that test, that list. This is the first step to get that done. So thank you, Mr. Secretary, for your continued leadership on this. I also want to call out one individual from my staff, Laura Kavanaugh, who is currently the Associate Administrator of the Maternal and Child Infant Health Program. She really wanted to get this done, and at the end of this month, she will be retiring knowing she got this across the finish line. So thank you, sir.
Thank you, Mr. Engles. Okay, now we're going to shift to a few of our policymakers that are here. We're going to start with Congressman Gus Bilirakis from Florida.
Thank you very much. I appreciate it very much, Dr. Herodopoulos. Thank you for your great work. Thank you, Secretary Kennedy, for all your great work and thinking outside the box. So very important. And Administrator, we really appreciate that. This is why we run for office, is to do good things like that, like this, that impacts the people directly. So we appreciate you so much. Today's announcement represents a monumental breakthrough grounded in human compassion. As co-chair of the Congressional Rare Disease Caucus, I have long worked to ensure that no child suffers due to a lack of diagnosis, and expanding newborn screening is a critical part of that effort. Including conditions like MLD and DMD in the newborn screening process is a major step forward. We couldn't do it without you. Please, thank you. I can't tell you how much I appreciate this, and my constituents as well. By identifying rare diseases early, we can dramatically improve a child's chances for timely treatment, and in some cases, cures. So very exciting. Supporting the development of treatments alongside these screenings allows us to deliver on the promise of modern science and give families real hope. This action also has long-term benefits for our healthcare system. Early diagnosis helps prevent complications, reduces years of misdiagnosis, and lowers overall healthcare costs. It also will serve as a powerful catalyst for research, biotechnology, innovation, and the creation of life-changing therapies for rare and ultra-rare diseases. I'm proud to be joined today by the Beecham family. Wonderful, wonderful people whose sweet daughter, Maddie is here, has endured. She's a beautiful little girl, a wonderful girl I got to know. And she has endured significant hardship because of her rare disease, and it's called biliary atresia. It was not recognized, unfortunately, at birth, even though it could have been identified through a simple blood test. I look forward to working with Secretary Kennedy and his team to expand newborn screening further and include even more critical tests. So again, thinking outside the box, getting rid of the bureaucracy, and doing the right thing by the American people, we are going to save lives. So God bless you for doing this. Thank you very much.
Thank you,
Thank you,
Congressman.
Congressman.
Well, going down the line, I'd love to hear from Senator Katie Britt from Alabama.
Thank you so much. I really appreciate being included today. What an incredible day for so many people. I want to start with Cecilia Grace. Thank you so much for sharing your story with me. When I met you in May, it was the catalyst. You are what drove me to make sure that we were fighting, to make sure that we had the proper research for rare disease, so that every mom and dad out there had the tools they needed to help their little one, and what helped me fight so hard to make sure that we were here today. So you are an incredible young woman, and I am so glad that you are an Alabamian. I want to thank Secretary Kennedy for your leadership here. I mean, it's just incredible. Other secretaries have talked about this. You are actually putting these things into action. You are a catalyst for ensuring that families in America, that parents in America actually have both the information and the tools that they need to keep their children safe and give them an opportunity to grow and thrive and live their American dream. So thank you for not just talking about these things with us, but putting them into action. You said timely care is compassionate care, and that's exactly right, and that's what this does today. So adding both DMD and MLD to the recommended uniform screening panels will be able to take important steps to make sure that parents at such a critical time when symptoms aren't necessarily showing up or there are very few, being able to get there quickly and get answers quickly to make sure that we can have the proper delivery of the drugs and the treatment that is needed. So we're so excited about that. And to Gary and to Casey, thank you for telling the story. Thank you for elevating your voice. You are why we're here today. So you and all of these parents around this horseshoe and parents across America advocating for your children is going to give someone else an additional chance and more time. And so we are all in awe of you. And we just say, keep going. And to all of my colleagues, it's an honor to work with you on these important issues. And we commit to you today that we're going to keep working and keep making significant improvements.
Thank you, Senator Britt. Senator Ron Johnson.
Oh, thank you, Doctor. Thank you, Administrator. I particularly want to thank you, Mr. Secretary, for taking all the slings and arrows, all the attacks, hanging in there. You're doing something very significant today. I just cannot thank you enough. Continue to hang in there. Like Senator Britt, I want to thank the parents and the patients that have come to Congress. Often it's not easy, in wheelchairs, talking to the members and making us aware, educating us as the struggles that you are dealing with. I championed Right to Try back in 2018. I'd met with the Goldwater Institute. 2 weeks later, I met with a young mom, Trickett Wendler, with ALS. She since passed. She actually passed before we passed Right to Try. When I mentioned that I met with the Goldwater Institute about their statewide effort to Right to Try, that I was going to advocate for it, tears started streaming down our cheeks. That was the moment I said, okay, I have to champion this. Met with other ALS patients, Frank Mangione, who's since passed, Matt Bellina, who is still alive today because of an experimental treatment made available through Right to Try. Those are the 3 ALS patients named on Right to Try. And then the 4th patient was Jordan McGlynn. Not an ALS patient, Duchenne muscular dystrophy. At the other end of the spectrum, a child with a rare disease and his mother, Laura, advocating tirelessly, again, This is not easy to do. But my message is it makes an impact. We're here today because of your tireless work. So we passed Right to Try to give people like Trickett and Matt and Frank and Jordan hope. And also a little bit more freedom to decide for themselves on a drug that hasn't been fully approved, but they know their condition, they know what the end result is. Give them the freedom to make that decision rather than a faceless bureaucrat. Today's announcement in terms of early screening is going to give families the chance of knowing their child has this condition, maybe access treatments, maybe available through Right to Try, to give their loved one, their child, a chance at having a better and fuller life. So again, this is incredibly important, but it's truthfully made possible because of people like Laura and Jordan and the other people who made my colleagues aware of these situations. But it wouldn't have happened without you, Mr. Secretary, and your the people who work with you tirelessly to do what's right. So God bless you and thank you. Keep hanging in there.
Thank you. Oh, Senator Wicker, you are recognized.
Thank you very much. I want to salute the scientists who've worked for over 3 decades to get us where we are today. Back in the early 1990s, Congress and the federal government decided to invest some money in the Human Genome Project, and we mapped the entire human genome. Then in 2001, a number of us learned, in the Congress, learned about Duchenne muscular dystrophy. I was visited by the father of a little boy named James. And he had been to Disney World and didn't want to run around and play like the other children, and they realized something was wrong, and he was tested, and it was discovered that he had Duchenne muscular dystrophy. That led to the introduction on a bipartisan basis of the Duchenne Muscular Dystrophy Act. It was co-sponsored by Senator Paul Wellstone, a Democrat from Minnesota. We felt that we had a Republican co-sponsor in the House. We had asked for a Democrat. And of course, a year later, he was tragically killed in an airplane crash. But I want to thank the researchers, and I want to strike a blow for bipartisanship. We couldn't have gotten this done a quarter century ago if we hadn't had bipartisanship on both sides. In 2021, the life expectancy of a little boy with Duchenne muscular dystrophy was 19. Today, the life expectancy of that same child is in the mid-30s. Let's say it's 35. That's 16 extra years of life for those patients, and we're only getting better. We found the dystrophin gene, and our researchers, I cannot tell you how grateful I am for their expertise and the education they've had and for their dedication. Now, Mr. Secretary and distinguished panelists, because we're going to be able to identify this disease at the time of birth, there's so much of an extra chance to add not mid to late 30s, but mid to late 40s and on eventually to a cure. We've done amazing things with a little bit of federal taxpayer money and some expertise from our federal government and some bipartisan support from both houses of Congress. This is a red letter day. It's a monumental achievement. It'll go down in history, and I'm so honored and grateful to be asked to be a part of it.
Thank you, Senator. Now I'd like to hear from the families. All of you have here have been affected in some capacity. But we have a few panelists here that want to tell their story. But before I do, I want to make one announcement. And this is brought to my attention. This little girl, Darcy, she got her angel wings 30 years ago today. Today, her mother, she fought so hard, Taryn, who's the head of the MLD Foundation, to get the diagnostic test. So it has the sensitivity and specificity test. So can you imagine 30 years ago today, she got her angel wings, and here we are at HHS doing that. Tell me that's not divine intervention. I'm going to start with First Family, of announcing Kendra Riley.
Thank you so much. Thank you all for being here and for making this possible today. I cannot tell you how grateful we are. As you can imagine, it's a very bittersweet day for our family. I'm here with my husband, Dave, and our daughters, Ava and Kira, behind me. But at home is our daughter, Livy, who's 7 years old and in hospice. She couldn't get the same treatment that our youngest daughter, Kira, got. So we've had to watch her worsen day by day while we're watching Kira thrive. And she has a bright future ahead, and it's because of these gene therapies that exist. And because of the many of you in this room and many probably not in the room, we're going to be able to prevent families like ours losing one child in order to save another. And it just means the world. Like I said, very bittersweet, but we are very grateful for all of you, Secretary Kennedy, Dr. Herodopoulos, the rest of you. Thank you so much, the entire HHS team, our home state representative, Greg Stanton, and Congressman Schweikert. There's been so many people along our journey that have helped us get to this point, and I've had tears pretty much all day. So thank you so much for making them happy tears. I appreciate it.
Thank you. Moving on to Alabama, Gary Hamlet.
I just want to thank everybody for having the ability to be here and to speak on behalf of my daughter. C. Grace in 2021 was the first child in the United States to get gene therapy for metachromatic leukodystrophy. She was the stepping stone for the FDA getting this approved. 2024, the FDA fully approved this for other kids in the United States. She is a little different from other kids. She didn't have a sibling that had the disease. We found it by fluke. In 2020, she had a problem with her gallbladder. They removed her gallbladder, found a large mass inside her gallbladder. The pathologist requested further studies, and the pathologist picked up on a neoplasm inside the mass that was associated with metachromatic leukodystrophy. She requested further studies and come back, found out she did have MLD. No signs, no symptoms of the disease. September of this year, we went back for her 4-year checkup. Still no signs of the disease. MRI was negative of the disease this year. No faint signs, no nothing of the disease. So we are pleased to have this. The newborn screening was a must for other kids in the United States. I want to thank Senator Britt, Senator Tuberville, and Representative Robert Aderholt, which is not far down from where we live at. A special thanks to Dr. Herodopoulos for all she has done. Thank you, Secretary Kennedy, for all you have done for this. This is a life-changing ordeal for many, many families in the United States. And we thank everybody. Thank y'all.
Hello, I'm Laura McLinn. I'm the mother to Jordan McLinn, who's right here behind me, who's 16 years old living with Duchenne. Secretary Kennedy, in case I forget, I want to start with just a thank you for today. This is everything to us, our whole community. who's fought so hard for this for so long. So thank you for making this happen today. I might be the only one at the table without notes or a phone because I had no idea why I was invited here today. I kind of had an idea, but I wasn't told. I was hoping it would have something to do with Duchenne, but I have no notes prepared. So I'll speak from my heart for just a moment. I was surprised and happy to see Senator Johnson, who's been a strong advocate for Jordan and Duchenne for many years now. Since you mentioned Right to Try, I'd like to share a little bit about that part of our journey. When Jordan was first diagnosed, we were given zero hope. There were 0 FDA-approved therapies. There were no clinical trials for Jordan. And when he was 5, we started advocating for the Right to Try law because we had hoped it would be a new and unique pathway whereby he might access a treatment that we heard was in the pipeline. Well, in the midst of that, Jordan became one of 16 boys in North America to make it into a phase 2 clinical trial, which is what we really wanted. And now he is almost 9 years getting weekly infusions for an exon skipping therapy that we believe is slowing the progression of his Duchenne. And we're very grateful for that. That drug was approved through the accelerated approval pathway in the midst of COVID in August of 2020. Jordan used to travel weekly with me to Chicago for almost 4 years to get the infusions. And now other boys living with Duchenne have access to these therapies because of the FDA's accelerated approval process. So we're very grateful for that. We now have 8 FDA-approved therapies for Duchenne. My son Jordan is on 3 of those therapies. This is the first time I have ever traveled on a plane with Jordan without a wheelchair. He's been walking. Yes. We can't stop, though. We have 8 FDA-approved therapies. We have 2 more under who have applications in now with the FDA, deramiocel and adalurin. One of those is not something Jordan can use, but it's something other boys that don't have anything yet for their specific mutation can use. We have deramiocel, which has the ability to treat the heart, which, as you know, the heart is a muscle too, and ultimately usually the one that fails our boys. So I wish you could have overheard the breakfast conversation that I had with Jordan. I'm going to tell on you, sorry. We had the most beautiful conversation at breakfast because, as you know, my Jordan is 16, so newborn screening does not affect Jordan or my family directly. But we had a suspicion and a hope that today was about newborn screening, and it meant so much to me to hear my son feel so proud that maybe we were at this point today and that other boys, future babies born with Duchenne, would have opportunities that he did not. And he even mentioned that, this could bring us closer to a cure for Duchenne now that we will know when babies are born. So thank you to everyone in the room. I hope I haven't left anyone out. I'm sure I have. But Secretary Kennedy, this means the world to us in our community. So thank you for being a world changer today, and means so much to us. Thank you.
Well, to all the families today, all your advocacy, this is a culmination of everything that you've worked for to get diagnostics, therapeutics, and now adding to the rest. God doesn't waste any hurt. So today, your children that you've lost in the past, when they receive their angel wings, it's not done in vain. You have been there. It led to your advocacy, what has led to other children's lives being saved in the future and progression of disease being stopped. So thank you for all your hard work, and you can rest a little bit now. We got it. So with that, we're going to, Secretary Kennedy, do you have any final remarks before we get to the big drum roll signing?
I'm just very grateful again to all of our elected leaders for listening to the public. And that's, we had sessions in here yesterday and a couple of months ago on long COVID and on Lyme disease, which are invisible diseases, and they were allowed to remain invisible for so long because this agency was not listening to patients. And I'm so grateful that we have legislatures now on Capitol Hill, these extraordinary group of people, and some of the politicians that we had here from congressional and senatorial representatives we had here yesterday who were listening and brought our attention here at HHS to these issues and allowed us to use the power that we have at this agency to actually do something for these children. Oh, I'm grateful to you. I'm grateful to the parents. I know that when you have a sick child, it is all consuming. And, you know, I have 7 children, and I've often heard the axiom that a parent is only as happy as their least happy children. And the amount of work that it takes to take care of these children, which you've done so brilliantly. But in addition to that, you have come to Capitol Hill, brought your children, endured these hardships, and make sure that other children will not suffer as they have. So I want to thank you on behalf of the country, on behalf of this agency, for those efforts you made. And I really want to thank all of you kids. And I hope I get a chance to meet you afterward.
Thank you, Secretary Kennedy. Well, I think it's the big signing of the executive memorandum. What we're going to do is what I'd like is to have the family members and the policymakers come behind the secretary as he's signing. If any of the children want to come up here in the front, so you are seen, cutie patooties, and then we'll get the family members of people who have been affected by these 2 diseases behind the secretary, please. We're going to have Administrator Tom Engles, once everybody's in place, hand the binders to him so they could sign. Everyone else, please just maintain your seat, and we will have some great pictures for you later on, and you'll get to meet Secretary Kennedy if you're not up here. So you want the kids?
Mr. Secretary, the first action you will be taking today will be deciding the Duchenne muscular dystrophy. Mr. Secretary, you will now be signing metachromatic Duchenne or leukoid dystrophy. Thank you, sir.